Okay. Well, thanks very much, first of all, for this lovely conference. It's great to be here. I've been looking forward to sharing with you something that we've been working on for a while. Where I'm from, I'm an adult endocrinologist from Aarhus University Hospital in Denmark, and I'm going to share with you something about transition and follow-up in adult OI. My disclosures. Well, Denmark is a relatively small country, and most of the the healthcare system is public, so that makes it sort of, that's the way it is. We've got two rare centers, or Center of Rare Disorders, located in Aarhus to the west and in Copenhagen to the east, where the children with OI are followed. And then we've got 3 adult care facilities at the endocrine departments in Aarhus, Odense, and Copenhagen. And we've been working on this, so it's been different, obviously. Previously, it's been the children have been followed at the Center of Rare Disorders at the pediatric department for many years. It's a team with the pediatrician and the pediatric orthopedic surgeon, and they've followed the OI child and the family for many years. And then we have an endocrine department where the adults are followed, and they've been followed next to patients with osteoporosis and in a broad adult clinic. And then we've got a number of other healthcare professionals around these patients, and we've been communicating whenever necessary. So doing some research many years ago, or some years ago at least, we found out that this transition, or the switch from the pediatric unit to the adult unit, was very important. It was like that the pediatric care suddenly disappeared. The main healthcare providers disappeared, and what we discovered was also that the patients went away. So they didn't turn up at the adult facility, and we didn't succeed in getting them to the adult service. But they turned up 10, 15 years later with a number of fractures and nowhere to go to, no good contact to the healthcare system. And I don't know if any of you see this or have seen this over the years, because I think it's happened many places. So we decided to work on this, because obviously this transition from pediatric care to adult facility is important. So we've got the pediatric team working around the young with OI and the family, and they're working on talking about the adult option when they reach 18 already, and they introduce it earlier, around 15 maybe, or whenever it's suitable, together with the healthcare people around the child. And when they get closer to that last consultation, turning 18, they call the adult team with an adult endocrinologist and a calcium metabolic specialized nurse. And we book a shared consultation at the pediatric department. So we all meet up there, and whoever else is essential or necessary for that child. And then we hear about whatever's important, recent fractures, social situation, family connection, and so on. And then we also make an effort to tell about the adult facility and explain the differences between the pediatric care and the adult facilities, because there are many differences. And then we give them our contact information, and we book the next appointment at the adult department. I think that's quite important, so they know where to go to. And we try to make it so that the physician, I'll hurry. The physician that's there will be the same that they meet at the first visit at the adult endocrine. So transition is important. Obviously, we've covered this many times today because it's transition from childhood to adult care, but also from living at home to living independently and so on. So many different things, and so many different things that can go wrong. Medically, we can lose history. We lose specific care persons that's been essential, and you go from a very broad medical or a pediatric department to a more specialized care. So we try to do this well-timed and in agreement with the patient and with the carers to make sure that we have a good offer to give them. We ask the pediatricians to list all the important things in the medical charts so that we have the right information available. Is there a genetic analysis? Do we know it? How many fractures? Any special social situations, and so on. And then we're working together with these numbers of different healthcare providers. And then we gather these in the adult OI clinic. We gather the OI patients on certain days in close cooperation between specialities, and we also do clinical meetings. We've done so actually for the last 10 years, I think, together with the Danish OI Society, bringing up ideas like this, research ideas, a number of other things. We meet up with a couple of members from the Danish OI Society, and whoever is interested in OI clinically at the hospital. Yeah, we prepare the visits, make sure that everything is in the charts, so we have the right information there, and we send out pre-consultation questionnaires to the patients. So before they meet up at the adult clinic, they get a list of possible subjects that they could talk with us about, so that they know what can I use the adult physician for? And it's everything from pain and fractures to cardiac issues or social problems or pain, whatever's there. So we prepare them to talk to us about anything really, and many other topics have been covered here today. And then we do semi-structured consultations, so we make sure that we ask the patients that show up at our clinic, ask them about pain, ask them about cardiac issues, ask them about social difficulties, loneliness, and so on. And then it also gives an opportunity to meet in the waiting room, and I think that can be possibly a good idea. It's definitely an option now that it hasn't been like that. That's the team. At the moment, 2 physicians, me and Bente, and then 2 nurses. We've got DEXA facilities and good collaboration with the orthopedics and with many others, hoping to involve a physiotherapist and a number of other healthcare providers as we go. And then for quality purpose, we do a REDCap database, so we can charge whether we ask the right questions, whether we've DEXA scan at the right timing and do hearing examinations and so on. Yeah, that's the goal, to do a safe clinical follow-up, but also a good transition, which is really key, I think. And then, of course, to generate more knowledge and generate research ideas. So that was what I was going to share with you today. And thanks very much for listening, and thanks to my colleagues, and especially a big thank you to the Danish OI Society that we're really having a good collaboration with.
Thank you. Thank you.